Thank you so much, Evan, and welcome everyone to our Kindergarten Matters series webinar, Back to School, Reducing Barriers to a Successful Start in Kindergarten. I'm excited to see so many folks who registered and joined to learn more about this pertinent topic. As we all know, the transition into kindergarten is a significant milestone in a child's life. It's a time filled with excitement, anticipation, and for some, a bit of apprehension. For many communities and families, this time is filled with a lot of questions about how best to prepare their young learners for the classroom. Uh, these questions can be a little bit daunting, which is why we felt that it was important to have a conversation on how best to support these families, communities, and students for this transition. Which brings us to today. I'm so excited to highlight this panel of experts that will dive into a few strategies and valuable resources that could be extremely beneficial in developing a positive and seamless transition into kindergarten. These include, but aren't limited to, boosting kindergarten enrollment, prioritizing health screenings and vaccinations, underlining the importance of daily attendance, and fostering trusting relationships. All of these topics and more will be delved into by our wonderful panel. And before we proceed, I want to encourage everyone, this webinar is meant to be interactive, and we would love to hear your thoughts and commentary in the chat box as we go along, and encourage you to post any questions that you have for our panelists in that Q&A box. And now I'm excited to Sorry about that. I'm excited to introduce to you our panel for today's conversation. Swati Adarkar is Deputy Assistant Secretary for Policy and Learning at the U.S. Department of Education. Prior to joining the department, Swati most recently served as the National Policy Director for Start Early. Previously, Swati was the co-founder and president and CEO of the Children's Institute in Oregon for 15 years, an early childhood policy and advocacy organization. Swati served on statewide advisory committees on early childhood for 3 Oregon governors and provided the vision and leadership to launch and sustain the Early Works Initiative, which aligns birth to 5 services and supports with elementary schools. Kathleen Holmes is a senior public health analyst in the Chief Medical Office in the Immunization Services Division at the Center for Disease Control and Prevention. She coordinates Let's Rise, which is the division's initiative to understand and address pandemic-related declines in routine vaccinations. Prior to joining the Immunization Services Division, Ms. Holmes spent a decade working in various global health positions at CDC, including the Division of Global HIV and AIDS, Center for Global Health, and Division of Parasitic Disease and Malaria. She also served on the COVID-19 response for 18 months, where she helped support COVID-19 vaccine rollout strategy and vaccine confidence and demand partnership work. Heidi Schumacher is a general pediatrician and assistant professor of pediatrics at the University of Vermont Larner College of Medicine. In this role, she serves as faculty for the Vermont Child Health Improvement Program, a statewide initiative that integrates public health, clinical quality improvement, and health services research. Previously, she served as the Assistant Superintendent Health and Wellness at the DC Office of the State Superintendent of Education, where she oversaw the health and nutrition portfolio of the district's educational system. She has also served as Deputy Chief of Student Wellness at DC Public Schools and Medical Officer at the Center for Medicare and Medicaid Innovation. She is an active member of the American Academy of Pediatrics, including serving on the Executive Committee of the Council on School Health. And Jill Sells is the Physician and Partnerships Lead for the Learn the Signs Act Early program at the U.S. Centers for Disease Control and Prevention. Dr. Sells is a pediatrician with over 20 years of focused work in health and early childhood. She previously served as the medical advisor for the National Center on Health, Behavioral Health, and Safety, part of the training and technical assistance system for the National Head Start program. She is a clinical professor of pediatrics at the University of Washington School of Medicine and past chair of the American Academy of Pediatrics Council on Early Childhood. And lastly, I'm excited to introduce our moderator for today's conversation. Chris Angale is an education leader with over 20 years of policy experience at the federal, state, and local levels, serving as one of Trust for Learning's co-directors and chief strategy and policy officer, Chrisanne uses her knowledge and experience to guide the organization's grant-making efforts and lead its national policy strategy to accelerate access to ideal learning programs. Prior to joining the Trust, Chrisanne served as Senior Policy Advisor at the U.S. Department of Education, where she was responsible for developing new policies and programs to expand high-quality learning opportunities for the nation's children. And with that, Chrisanne, I'm so excited to pass it over to you to get us started on this exciting conversation.
Great. Thank you so much, Sierra, and welcome, everyone. I am delighted to be moderating this conversation today. As Sierra mentioned, I served at the U.S. Department of Education from 2012 to 2017 and worked primarily on early learning policy. But for the last 7 years, I've served on the leadership team at Trust for Learning, a national philanthropic partnership committed to a vision of ideal learning environments for all children and families, prenatal to age 8. We work with partners around the country who are bringing equitable, child-centered, developmentally appropriate learning environments to life in all kinds of publicly funded settings. Recently, much of my work has focused on pre-K and kindergarten, which we all know can be a pivotal time for children, families, educators, and schools. In many communities, kindergarten entry is a critical time of transition as children and begin their first year of formal schooling. And from an ideal learning perspective, that means really being prepared to meet every child where they are, to welcome them into a kindergarten classroom that supports their own developmental needs and continues to engage their innate curiosity, wonder, and excitement about learning. It means reaching out to families to welcome them into the school community and ensure that children have the necessary vaccinations, services, and supports to help them thrive. There is a lot to think about during this critical transition, and we are fortunate to have an exceptional panel to engage in this conversation with us today. So I'd like to start with Swati. As Deputy Assistant Secretary for Early Learning Policy, I'd like to get your reflections on why are we having this conversation now? Why is it so important to focus on preparing families, schools, and communities for the start of kindergarten now in May as opposed to in August?
Thank you, Chrisanne. Hello, everyone. It's great to be with all of you today. A special thanks to the Campaign for Grade Level Reading for this Kindergarten Matters webinar series, and all you're doing to lift up the significance of this kindergarten year and the transitions both to kindergarten and first grade. It's an honor to be part of such a distinguished panel of pediatric and public health experts who bring important and timely information, tools, resources, and how to support young children's healthy development, a foundational block to everyday school attendance and early school success. And I very much appreciate Chrisanne Gale moderating this session. I've had the pleasure of building on the early learning groundwork of Chrisanne and my two predecessors at the Department of Education, Jacqueline Jones and Libby Doggett. And thanks to all of you who are joining and for making time at a really busy time in the school year to learn more about how together we can seize this window from now this spring through the back to school window to lay the path for early school success for every young learner. We have an opportunity to provide rising kindergartners with a smooth on-ramp to school and to be intentional and coordinated in our strategies to connect parents, families, communities, health providers, early educators, and elementary teachers and administrators to build kindergarten as a sturdy bridge between the early years and the early grades. First slide. I want to remind folks of why the Department of Education has embraced a two-track early learning strategy across the preschool through third grade continuum through our Raise the Bar initiative, and how we work closely hand in hand with our partners at the U.S. Department of Health and Human Services on the foundational years before kindergarten. Our agenda prioritizes the students who've been hardest hit by the pandemic, low-income students, English learners, and children with delays and disabilities. It attends to the urgent need to support children's healthy development, opens the door to high-quality early learning experiences, and supports everyday school attendance and early school success. Next slide, please. Oh, we're on the right slide. As you see on the slide, these are our 2 tracks for the department's early learning agenda. The first track is to expand access to high-quality preschool, encouraging the use of Title I funds. Our second track is to ensure kindergarten is a sturdy bridge between the early years and the early grades. These strategies address the 2 consequential opportunity and achievement gaps essential to improving third grade outcomes: the gap at kindergarten entry and the widening gap during the kindergarten year. Next slide. Remember that kindergarten is our first opportunity at scale to reach every student who comes to kindergarten and provide those critical supports and interventions that we know can assure on-track development. That kindergarten is a key inflection point for which students will experience early school success and which will not. Kindergarten is an important opportunity to partner with parents and families to build the relationships, routines, and habits that are essential to early school success and to everyday school attendance. At this time where we're seeing extraordinarily high chronic absence rates, reduced kindergarten enrollment and vaccination rates. Next slide. These factors have catalyzed our focus on the back to school window and elevated 3 areas of concern and opportunity to ensure early school success. And you're going to hear more about that today with this terrific panel. First, let's catch up on missed early childhood vaccination and children's routine well child checkups to prevent the spread of infectious disease, help more kindergartners begin the school year on time, stay healthy, and stay in school. Second, let's support kindergarten enrollment efforts that begin early and provide clear communication and outreach in multiple languages, and build relationships with community organizations, families, and most of all, parents, so they know when, where, and how to sign their children up for kindergarten. We want it to be easy. Third, let's ensure robust and seamless kindergarten transition efforts, so we reach the most underserved children, and we go beyond a light touch approach to make sure we're meaningfully engaging parents and families and community organizations and helping connect early educators with early elementary teachers and school leaders. We know that kindergarten transition efforts can be further enhanced by making sure we're doing summer programming and connecting families and children to summer meals and connections to their health providers for children's health checkups. We're eager to work with you to seize this window from now to back to school. And we've put together some resources on the following 2 slides to support your work on advancing early school success. And the department's Student Engagement and Attendance Center has been running a 3-part series on kindergarten chronic absence. Tomorrow is the last one, in which we'll have a really engaging panel. And in the chat, I believe some of those resources will be shared. And if you're interested in signing up for tomorrow's program, it'll be virtual. We know that together we can transform the coming school year for our incoming kindergartners by giving them a smooth on-ramp to early school success. Let's commit to demonstrating why and how showing up to school every day in kindergarten and being present and engaged counts. Thank you so much.
Thank you so much, Swati, and thank you for your leadership and for your focus on early learning at the Department of Education. I really appreciate that perspective as we get ready to hear from our other panelists. So Heidi, let me turn to you first. I know that in your role as a general pediatrician and with the American Academy of Pediatrics, you have this special emphasis on supporting young children from birth to early adolescence. Can you tell us why that focus is so important?
Absolutely. Thank you, Chris-Ann, so much. And I should say this wasn't in my bio, but my most important perspective here is I am the parent of a kindergartner. So I'm with you all, both professionally and personally. But thanks again for the opportunity to speak on behalf of sort of the world of pediatrics, and especially the American Academy of Pediatrics, which, as you know, KUSAN has had kindergarten readiness and many other aspects of school performance and engagement as some of our core focus as an organization. We can go one more slide. I have no disclosures. And then the first content slide. Thank you. So first, I think the message that we as pediatricians sort of join you in is that we know, and Swati mentioned this, kindergarten readiness, of course, doesn't begin in August or even in May going into kindergarten, but really kindergarten readiness begins at birth. And we know from very robust science that all of a child's early experiences, both at home and in home-based or childcare-based or preschool-based care settings, all of those experiences are educational. And actually, all of those experiences impact how a child's body and brain develop. So we know positive, consistent early experiences really support readiness to learn. We know, of course, as you all know in the field, that readiness to learn at these early ages, especially kindergarten, predicts then longer-term academic success. And as healthcare and public health professionals, we know that academic success, performance, graduation from high school, et cetera, is one of the leading predictors of long-term social, economic, and health outcomes. So it's really sort of a bidirectional relationship here. And I'll say too, when we talk about early experiences, we're not just talking about pre-academic skills. We're talking about sort of holistic child development, physical well-being, social emotional skills, language skills, problem-solving skills, and all of that really begins at birth. You can go to the next slide. And so this is sort of just a different representation of what I was just talking about, right? We know that health contributors are some of the most important inputs to academic performance and success. We know folks who are academically, who have been successful throughout their trajectory are more likely to have long-term health. And of course, we know poverty and other social factors really undergird both success and disparities in both of those categories in an interrelated way. Next slide. So just to talk on some of those disparities or some of those contributors, we know, for example, that kids living in poverty are significantly less likely to be ready for school at age 5. And relatedly, kids who have experienced trauma, so I'm not sure how familiar folks are, but adverse childhood experiences are something we talk about a lot in pediatrics. Those are experiences like abuse or neglect, witnessing violence in the home, having a parent or guardian be separated due to death or incarceration or divorce. A child who's experienced 2 or more of those things is significantly more likely to repeat a grade. And there's lots of interrelationship with other sort of social determinants here, and interwoven here are disparities across lots of different socioeconomic, racial, ethnic groups as well. So we know that all of these factors, again, really implicate not only experiences that a child has, but truly how their brain develops. And this has long-term effect in their life, academically and beyond. Next slide. So this is a busy slide, obviously, but if you actually click through the animation, you'll see the National School Readiness Initiative has identified a number of core indicators, and these fall into categories of family, child, early care, and school factors. Many of these, of course, as discussed, relate to social factors, but you'll see a number of these. They're interrelated, of course, but tried to point to those that are especially sort of direct health or health care measures. Things like lead poisoning, things like health insurance, birth weight, access to prenatal care for the parent, immunization status. All of those are ones that particularly the healthcare space and public health organizations are really well positioned to support you on in the field. So I hope you think of folks on the health side as really right here with you all in the education side, wanting to get to success for children and families. Next slide. And to that point, this is a really tremendous series that came out last year from the National Academy of Medicine, actually highlighting school readiness, among other educational things, chronic absenteeism, graduation rates. as something they're encouraging health folks to think about as a vital sign. And a vital sign, folks might know, right, is a fever, blood pressure, heart rate. But something like school readiness is right there with those other more traditional vital signs, in that they can signal a child who's ready for school, or perhaps who's not ready to school, what's underneath that. As the clinician, how can you diagnose sort of what some of those undergirding factors are? And similarly, the American Academy of Pediatrics has put out multiple rounds of technical reports and policy statements on how school readiness should be considered really within the healthcare space. So next slide. So to bring it all together, school readiness really begins at birth. We know that health and educational outcomes are inextricably linked from that very early age, and both really impacted by poverty and other social factors. We'll talk about this more throughout this discussion, but I hope folks on the early care and education and schools front really see public health and healthcare partners as being invested folks who really want to join with you in supporting school readiness for kids, families, and communities.
Thank you so much, Heidi, for that holistic view of child development and its connection to long-term outcomes for children throughout their education career and on into their adult years. Now, as we acknowledge the kindergarten year as the pivotal point that it is, could you speak some to the focal points that require our attention and what the American Academy of Pediatrics is doing to address some of those challenges that families might encounter? I'm particularly curious to hear your thoughts, not only on how families get their children ready for kindergarten, but how do we make sure that the early childhood community is able to work with schools to ensure that all kindergarten programs are ready to welcome these children?
I love this question. Thank you, Chrisanne. I'll start by grounding us, if you go to the next slide, in sort of how folks in the health and healthcare space, and really this comes from American Academy of Pediatrics policy and technical guidance for folks in the field. So we really, as pediatricians, see our primary role in a few different categories. Many of them Swati touched on in her remarks too, but screening for psychosocial risks. We see children typically with a parent or guardian or caregiver. And so we can really look holistically at the family to understand where there may be both strengths, but also risks that we can connect them with evidence-based supports. We also do a lot of developmental screening, surveillance and screening, and Dr. Sells will talk on that more in this presentation, but really to identify kids with potential disabilities at the earliest age possible and connect those families with early interventions. We, of course, identify and treat physical health conditions, and then we provide routine immunizations, again, which you'll hear more on. So we step back and try to think really comprehensively in addressing not only the child's health and development and well-being, but also, where appropriate, that of their family. And we counsel pediatricians, this comes from AAP guidance, pediatricians and their teams to really engage at the individual level. Things like helping families to incorporate things like daily reading, which we know is an evidence-based intervention that helps prepare kids for school. It also supports family bonds and lots of other ripple benefits. We educate parents on normal child development and behavior and coach them through, evidence-based positive interventions to support behavior. And I won't talk on this in a ton of detail, but the AAP actually has a large priority around the importance of school attendance as something that pediatricians should be asking families about, and really engaging, emphasizing the importance of that regular attendance because of its relationship to long-term academic success and ultimately health. And then at the systems level, and I think any of these are opportunities for partnership with you all in the childcare and school space, we really encourage pediatricians to advocate for things like expanded access to quality early childhood education, advocating for high quality schools and services in them. And so I hope you'll also think about pediatricians in your community as voices to amplify what you know is best for kids on the ground in your settings. We can go to the next slide. So again, I tried to summarize here, healthcare and public health partners, I think, can really support care coordination for individual kids and families, In many cases, there can be really thoughtful data sharing efforts to really streamline care for kids and families and populations. Joint advocacy, joint messaging is always an opportunity with child serving folks like pediatricians. And if you're hearing this and you're like, that sounds great, but I don't know who to even start with. Every state in the US has a chapter of the American Academy of Pediatrics. In some of the bigger states, New York, California, et cetera, they have multiple chapters. And there are oftentimes folks with special interest in early care and school health. And so they may be folks who are good places to start. I'll drop my email into the chat, but if you're wondering, how do I get started? Do you know who I might contact? Please feel free to reach out to me. I'm happy to help connect you.
Chris-Ann, I think you're muted.
Thank you so much. Sorry about that. I just wanted to say thank you so much to Heidi and how helpful it was to hear her perspective and to learn about the work that's being done through the American Academy of Pediatrics. But I'd like to turn now and bring Jill into this conversation. Your work at the CDC through Learn the Signs, Act Early hones in on the importance of early childhood development as well. Can you tell us a little bit about the program and how it supports families and caregivers in pre-K and childcare programs, and how these programs can work with families to support early identification?
Absolutely. Thank you so much. I'm really happy to be here with everyone today, and I know how busy you all are. So thank you for taking the time to join us. And I've had the privilege of working with the early childhood community for a long time, and I know how hard your work is. And I just want to start by saying thank you for all that you do each day in your work with children and with families, and really welcome the opportunity to talk to you about Learn the Signs, Act Early, and to focus on what we call developmental monitoring and how that connects with families and how we can support families and partner in the work that you do with them. Next slide. So why focus on child development? Well, as you know, and our other speakers have laid the groundwork for, the early months and years of a child's life really form the foundation for everything that comes after that, for their future health, their development, and their learning. And all of this time is so important. And we know from evidence and experience that young children learn best through those nurturing relationships with their families and with the primary caregivers and the main people that they spend time with in those loving, close relationships. We know that families need information and support to understand how children learn and grow from birth through kindergarten and beyond. We know so much now about how children are really born wired to learn and are just eagerly doing that all the time. But adults are not born knowing exactly how that all happens. So it's really important for parents and all of us who work with children to have sort of some of that background knowledge to be better able to support that development. Next slide. So I want to quickly mention developmental screening, as Heidi did a little bit earlier. Many of you may do developmental screening yourself or have seen the results of it, so you've heard this term, but I just want to carefully point a couple things out. Developmental screening is a formal process using a validated screening tool with the child or child and family. Some examples you may have heard of are the ASQ or the SWIC or perhaps the MCHAT for autism. These are done by healthcare providers and early childhood professionals who have special training in how to use these tools. And they're designed specifically to try to get at whether there are developmental delays or disabilities that might need further evaluation. And there is a recommendation out there also from the American Academy of Pediatrics around developmental screening being routinely recommended for all children at 9, 18, and 30 months, with autism-specific screening also at 18 and 24 months, and additionally to do screens whenever there's a concern. Developmental monitoring and screening complement each other, and both are important, but they're not the same thing. And I just want to let you know that what I'm going to be focusing most on today is developmental monitoring and then how it might connect with screening. Next slide. So what are developmental milestones? Well, these are things that most children can do by a certain age. Children reach milestones in all aspects of how they're growing, how they play, how they learn, how they speak, how they act, how they move. And tracking these milestones offers a really important information about each child's developmental progress across all these different areas. All children develop at their own pace and are unique. However, most children do reach developmental milestones at or around the same age. Next. So what is developmental monitoring? So this may be a term you've heard of or may not be familiar to you, but it's really looking at how an individual child grows and changes over time and whether they're meeting those sort of typical developmental milestones across development. Families and those who work with families, previous slide please, who work with families can use a checklist of milestones to see how a child is developing. And if a child is not meeting a milestone or multiple milestones, it's important to encourage families to talk with their child's health provider about their concerns and to ask about developmental screening. Next. One of the reasons that this is really important is because developmental disabilities are really common. And I find that people often haven't seen these statistics. And unfortunately, they're often not identified before school age or before kindergarten. 1 in 6 children from 3 to 17 years old has a developmental disability, and 1 in 36 8-year-olds is estimated to have autism or autism spectrum disorder. Developmental disabilities are even more common among children from low-income households, with 1 in 5 children experiencing a developmental disability. So this is not an infrequent thing. But the good news is there's a whole array of different issues that children may have, and they all benefit from supports to meet them where they're at and help them make progress along their development across all aspects. And the sooner that we kind of understand what's happening and whether the child or family could benefit from supports, the better. So why is developmental monitoring important? Well, kind of what I was just starting to say. This ongoing developmental monitoring and developmental screening tied together can help families and communities and schools identify children with developmental delays or disabilities as early as possible. And when that happens, when they're identified early and children are able to receive early intervention or other needed services, children have better outcomes. Next. Now, the other side of this is that it's not just about finding potential problems or concerns. That is definitely really important. But child development is fun. Parents have an innate interest and curiosity about how their children are developing. And by encouraging regular developmental monitoring, we're trying to make it so this is sort of a normal process, that we're watching the children in our care or the children in our own home and noticing what they're learning and what they're doing. And that makes us better able to support what they're doing and to anticipate what might happen and to really celebrate and be joyful in what we're seeing and what's happening with the child. And this is a resource from the CDC that I hope you'll tap into because I think it's quite fun. It's called Milestones in Action. And we're going to bring up, I think we're going to try to bring up a video here that pulls from that. We'll see if that works.
Well, I made up a song this morning.
You did? I definitely want to hear that.
But I don't know what I should name it.
Well, sing it and then maybe we can figure it out.
Peaches, peaches, they're so yummy. You'll ever want a peach, 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 peach.
I don't know if you could hear that. It's always tricky to try to do videos live, but if we bring up that slide real quick again, you'll see the link to that website. And milestones, I'm going to talk more about our program later, but milestones are things that are things that you can observe and see in your interactions with children, but you don't necessarily know what to look for. So we have pictures or videos for every milestone associated with the program at different ages. And there's some examples here of videos of a 2-month-old who's smiling when you talk or smile at the child, or how a 9-month-old is getting themselves into a seated position, or 3-year-old is able to draw a circle once you've shown them how, etc. So I'd really encourage you to look at this, and it's really a great reminder of really the wonders of child development. Next. So this is just a brief slide about our program, and the mission of Learn the Signs Act Early is to really improve early identification of developmental delays and disabilities by promoting what we call family-engaged developmental monitoring, encouraging families to do this on a regular basis, and screening so that children and their families can get the services and supports they need. And our program is free and available to anyone. And our strategy is really to share it and partner with the medical community, with WIC programs, with early Head Start, childcare programs, and communities, anybody who works and interacts with children and young families. So you'll hear more about this later, but happy to be able to give you that background.
Thank you so much, Jill. And thanks for sharing that video. I'm feeling like I really need to eat a peach right now. I'm not quite sure why, but that little girl was so cute. And thanks for emphasizing that it's really about everybody that's involved in a child's life connecting with these resources. So thank you. So Kathleen, thank you for being so patient as we come to you next. You, like Jill, add a beneficial perspective to this conversation through your work with the CDC under the program Let's Rise, which emphasizes the importance of routine immunizations. Could you share a little bit about this program and how it came to be and what the data is showing as it relates to youth immunizations?
Thanks, Chrisanne. And I'd like to echo my colleagues in saying it's a pleasure to be here with you all today. I'll be highlighting the pandemic's lingering impact on school vaccinations and opportunities to improve kindergarten health and readiness. Next slide. So in the wake of the COVID-19 pandemic, as I'm sure you're aware, disruptions in routine health services resulted in declines in routine vaccination in the United States. Next slide. In response to pandemic-related declines, CDC's Immunization Services Division launched the Let's Rise initiative, which stands for Routine Immunizations on Schedule for Everyone. The overall objective of Let's Rise is to act quickly to recover routine immunization coverage to pre-pandemic target levels in order to prevent a rise in vaccine-preventable diseases, including severe disease and disability. Activities include engaging and equipping partners with evidence-based tools, messages, resources, and data to support catch-up, communicating directly with parents and caregivers to keep childhood vaccination top of mind, and monitoring progress towards recovery. So here you can see in the aftermath of the COVID-19 pandemic, coverage rates declined and have not yet rebounded among young children living in poverty and in rural communities, kindergartners, and among teenagers for HPV initiation. Next slide. For kindergartners, national vaccination coverage declined from 95 to 93%, which is the lowest level that we've seen it in decades. So you may be wondering why CDC is concerned when overall kindergarten vaccination coverage remains high. First, in order to prevent vaccine-preventable disease outbreaks, it requires very high vaccination coverage, above 95%. So schools and communities with waning coverage below 95% are at risk for outbreaks. Declines in vaccination were also uneven. While national coverage dropped by 2%, some states dropped by as much as 10%. And finally, the expected rebound in kindergarten vaccination coverage has not yet occurred, even after nearly all schools returned to in-person learning and healthcare services such as annual checkups began to normalize. In total, we estimate that 725,000 early learners entered kindergarten during the pandemic who were not up to date on their vaccines and are potentially susceptible to vaccine-preventable diseases. Additionally, school vaccination exemptions have increased to an all-time high. Around 3% of kindergartners were exempt last year. On a jurisdiction level, the number of states that have exemption rates above 5% and thus are no longer able to achieve herd immunity, even if all non-exempt students are vaccinated, has increased from 2 states in 2020, 2021 to 4 the following year, and 10 states last school year. Next slide. So what are the implications of pandemic-related declines in childhood vaccination for children and schools? First, even small drops in vaccination coverage put children at greater risk for illness, including serious illness, as evidenced by a 30-fold increase in measles cases in Europe last year. The US is now also experiencing a rise in measles cases and outbreaks. In the first quarter of 2024, we have already seen more than double the number of measles cases reported than in all of 2023, including cases in schools in Florida and Chicago. Next slide. Drops in vaccination coverage also put under-vaccinated schools at risk for exponentially larger disease outbreaks. Modeling done in 4 Texas school districts estimated that a 5% decrease in MMR vaccination coverage, which was seen by many schools and states during the pandemic, would lead to a tripling of measles cases. And to put this in context, it's not only about 6 students missing school. In many states, unvaccinated students and staff exposed to measles cases are also required to stay home for 21 days, which is a substantial loss of classroom time. Next slide. So our strategy, similar to Learn the Science, Act Early, for Let's Rise is really working through partnerships. And you can see on the slide a number of the partners that we're working on around routine vaccination and recovery efforts. Given widespread declines in vaccination coverage among kindergartners, we see educational professionals such as yourselves and early care and education providers as key partners in this effort. You are trusted leaders within your community, and as such, you have a unique opportunity to support families in getting their children up to date on immunizations. Next slide. Some of the ways in which we are working at CDC to engage and equip immunization stakeholders to support this work, including educational professionals, are noted here and include developing a partner webpage, which includes evidence-based strategies and resources. We also have new communication materials for back to school that were informed by research with parents that we will be putting in market from June through September. And we can share those when they become available. And we'll also be launching a number of back to school activities over the summer. And these are really supported at the highest level of CDC. The CDC director herself is planning to do a bus tour this summer. Back to you, Chris-Ann.
Thank you so much, Kathleen, for sharing those data. They are sobering. And with that in mind, could you share with us a little bit more about the relationship between immunizations and attendance and what this means for kindergartners and their families?
Sure, that's a great question. As I mentioned, pandemic-related declines in vaccination put students and schools at increased risk for vaccine-preventable diseases and outbreaks. And as you've mentioned, the impacts of which extend beyond health and safety, it also impacts student absenteeism and in turn, academic achievement. Well, absenteeism, we know, is multifactorial. We recognize there's no magic bullet to solve this issue. We do believe routine vaccinations are one tool that can help keep kids healthy in school and ready to learn. Vaccines can optimize student health and minimize missed school days due to illness by providing immunity and preventing disease outbreaks from beginning, by reducing the spread of disease in schools, thereby reducing the number of students and teachers that get sick and are absent, and the probability of unplanned school closures due to illness, and by reducing the duration of disease and thereby the number of school days missed due to poor health. Next slide. And this is supported by research which shows that vaccination decreases absenteeism in schools. When comparing students vaccinated for flu, for example, to those unvaccinated, schools reported a relative reduction in absences among vaccinated students by 21 to 66% during the flu season. Next slide. So the good news is that even with declines in coverage, most states can still achieve target coverage. Based on the reported data from last year, nationally, 3.9% of kindergartners were not fully vaccinated, but also not exempt. Meaning if all non-exempt students were vaccinated, our national coverage could increase from 93 to nearly 97%. Next slide. So in summary, some groups of children have fallen behind on routine vaccinations in the aftermath of the COVID-19 pandemic, including kindergartners. And small declines in vaccination coverage can have large impacts. It's not too late to protect our communities. Routine immunization catch-up is a goal that we can achieve by working together, and we look forward to partnering with you to support kindergarten readiness by keeping kids healthy in school and ready to learn. Thanks.
Thanks, Kathleen. Appreciate you sharing that information with us and talking about the RISE program. Many of the panelists today mentioned the importance of partnerships in your work. And I'm curious, with that sort of key context established, I have a question for all of you or whoever wants to answer. In your experience and expertise, what do you believe, why do you believe that partnerships are crucial when it comes to preparing children, families, and educators? And more specifically, what does an effective partnership look like that would support a more seamless and positive transition to kindergarten? So who wants to take that one first?
I can try and start. So first, why are partnerships important? I mean, they're critical to everything that we do with children and families, right? Children don't grow up by themselves. They're dependent on the adults around them. And so the support of their family and their family's ability to provide the supports that the child needs at home is critical. And then likewise, the community and school environments all need to be ready. And it's important because parenting is hard. And child health and development are complex. And our health and education systems, frankly, are not super well functioning all the time. They're hard to access, way too hard to access, despite our best intentions. So the only way that we can overcome those limitations and really provide children and families with what they need is through partnerships. And some of how I think this looks, we really have to keep children and family at the center. This is what our jobs are, right? We're pediatricians, we're teachers, we're childcare providers, because we're trying to support them. And we just have to remember that, even though our jobs are really, really hard, and I recognize that. I think we as adults, all of us individually and our systems need to take responsibility for trying to make things easier for families wherever we can. All of us need to be supported in our own careers and our own lives. And that's an important parallel topic. So I'm not minimizing the stress that we're all under as providers and families, but we still need to find ways to work better within each of our systems and to work better across our systems, and to try to make things easier for children and families. And then perhaps above all, I think we all need to try to be kind. It's hard. It's hard to do sometimes with all the stresses that we're feeling, but a little kindness goes a long way in all these efforts to support families.
Thanks, Jill. Does anyone else want to weigh in on that question?
Weigh in. Jill, that was terrific. I think the only couple extra points I might add are, having now worked in a number of different places that are quite larger systems, and now I'm in Vermont, which is a very small state. No matter, it all ultimately comes down to relationships, right? And trusted voices, trusted relationships, both that the family may have differently in different spaces, but also that we as professionals have. And I'm sure everyone listening has experienced this, but I can't tell you how many times a family has says like, I'm going, my school or my childcare is saying this, you're saying this other thing. So, all these different voices that they're feeling, which is genuinely confusing and disheartening, I think, and not trust building. But also, in the end, if we just talk to one another, just like sometimes literally just pick up the phone, it sounds so simple and 1980s-ish, but ultimately just picking up the phone or sending an email, even if we don't have a direct relationship with that other party. And sitting together in the space sometimes can be so transformative, just starting with that simple relationship building on either end.
Thank you so much. I appreciate that. Yeah, one of the principles of ideal learning at our organization that we talk a lot about is the importance of relationships and how children learn through relationships. And I couldn't agree with you more. The importance of those relationships, Heidi, you know, that's important through our entire lives. And so much depends upon that. So just wanted to remind everyone that you can go ahead and put your questions in the Q&A box if you're interested. Our panel has actually been answering many of your questions as we've gone through this webinar already. So I think we only have one in the box right now that currently has not yet been answered. I'm just going to throw it out there for one of our panelists to think about, which is, are there any developmental screenings that you recommend for preschool? Something to think about.
I'll
Also,
touch briefly. Oh, sorry.
go
Did you
ahead.
want us to go ahead? I'll touch briefly on it, and then I'll let Heidi, who's closer to practicing pediatricians at it as well. When I mentioned the screenings that were recommended earlier, it's because there's sort of these standard ones that everyone needs to do when children are very young. But anytime that there's a concern, a developmental screening can be done. And so there are similar screenings for older children. They're just not always done for every child. But at every one of those checkups, there are conversations about all aspects of child development and opportunities for further screenings or evaluations as they make sense. So it's just a little bit broader possibilities of what that might look like, depends on the needs of the child and family. And I'll see if Heidi wants to add to that.
Just that, yes, as Jill has said, there are specific best practices in the pediatric and family practice space that articulate, 3 developmental screens, 2 screens for autism in those first several years. And back to the question about partnerships, I think many times when I've worked in schools and childcare, the professionals on the ground on the ed side don't always know what screenings have been done, where a family might have been referred. So it ultimately, I think, comes back to partnerships. Either if a childcare or school feels that they want or need to do their own screening, that's great, but there may also be a way to coordinate care with the medical homes to avoid needing to sort of duplicate some of those screenings or to coordinate on the referral and the next steps for the family.
Thanks, Heidi. Appreciate that. And I know many of you have shared some resources as we've gone throughout this hour, but I'm curious and would love to, hear a little bit from anyone who's interested in highlighting any resources from your organizations that you particularly would want this audience to know about. Are there any sort of key components or materials that you'd like to highlight?
I have some slides that'll show some of ours. We can do it whatever order you'd like, but whenever that makes sense, happy to do that.
That sounds great. Thanks, Jill.
So I'm really excited to work with this program that has actually been around for about 20 years, but is really, really some exciting new things out there to want to make sure you're aware of. So as I mentioned earlier, the Learn the Signs Act Early program provides free resources available to all of you and to all families. It's high quality information that is research-based and really intended to engage both families and providers from 2 months through 5 years. And the what we call checklists or the milestone lists are designed to coincide with when all of those early childhood checkups are recommended. So there's regular checkups from 2 months right up through 5 years, and each one of them has an accompanying tool like you'll see on here, and we're showing the 5-year-old because we're talking about kindergarten. That's the print version right there, and you'll see the phone app there, and we'll talk about that more in a moment. But really the name of the program and what this is about is helping families learn the signs or what is typical development and encouraging them to act early if they have any concerns or questions. Next slide. The materials are designed to be relatable and accessible, written in a family-friendly kind of language. milestones that are easy to observe in a child. You know, sometimes there are things where people used to have to sort of like test or try to set up a child to demonstrate something. And this is meant to be things that you see in everyday life when you're interacting with a child. They were tested for understanding with families of diverse backgrounds, and they're available in multiple languages and a variety of formats. So there are paper checklists, there are online ones where you can go on the web and fill them out, and you can actually email the results to yourself or to a provider or someone you want to share them with. And there's the app version, which we'll talk about in a moment. And as I mentioned earlier, it's really a lot about encouraging parents and caregivers to track and celebrate those childhood milestones. And importantly, the milestones in the CDC's Learn the Signs program are those that 75% of children are expected to achieve by a given age. And that's important. They were chosen on purpose because if there is a missed milestone amongst these, it means that there's enough of a concern to have a discussion about it. It doesn't mean that the child necessarily has a delay or a diagnosis or something is wrong per se, but it's just enough to say, well, this is something we should talk about. And when you go in for that checkup, share this information with the provider. It's also intended to provide clear and concrete guidance on what to do when there's a developmental concern. We're not trying to just have people be worried and then not know what to do. Again, it's really trying to encourage that conversation and relationship with the health provider, and to ask about developmental screening, and to consider early intervention or other supports which may help support the child along their developmental trajectory. This is just a quick slide showing a lot of the resources. There's the milestone checklist, which I mentioned, but there are also children's books that are available for free that kind of demonstrate child development within the story. In the center there, we have the Watch Me training, which is a free online training for early educators, and childcare providers and others across the country use this. And we'd encourage you to look at that if it makes sense for you. The milestones in action, which I mentioned. So we encourage you to just go to our website at cdc.gov/act early and explore and see what might be fun or helpful to you. Next. I do want to draw attention to the app because it is super fun, and I hope that you will check it out. There are interactive milestone checklists for each milestone, showing that photo or video from ages 2 months through 5 years. So that video that we tried to show you, those are all embedded in the app. So if you go and you put in a child who's a certain age and then click on the checklist, it'll show you exactly what it looks like. And it's quite fun to look at that. The app is available in both English and Spanish. It's completely free and there are no ads. It's easy to use, and you can just download it from the App Store or Google Play. We recently passed the 2 million milestone for downloads. So people are really starting to use this and enjoy it. And we just want to make sure that you know it's available. So how does this relate to kindergarten readiness and developmental monitoring? Hopefully that's clear from the discussion that we've had so far. But some of the things that might make sense for you to do in your community, if you choose to highlight these and share the resources with families, it really can help build those trusted relationships, especially if they're making new relationships with you, wherever your role is in the community or at a school. You're giving them something free that's supportive and celebrating of their child, and that may help as you start to connect and show that you're interested in their child in that way. It's helping support families directly by helping them to build their knowledge and skills and resources around supporting their child. And that in turn can help children develop their skills and be ready for school. And as we've talked about, can help us collectively identify children who might have possible developmental delays. So what can you do today? Again, we hope you'll go and download that app and see for yourself. Visit our website to look and see if the resources and information might be helpful to you and your community. And you can certainly spread the word through newsletters and other outreach to families. If you're doing kindergarten or preschool registration right now, you can share it with that or at back to school events with various early childhood partnerships, which we've talked about. It's all about having the community all involved in this and sharing and supporting parents, whatever sort of door they might walk in. And of course, this can happen year round, wherever young children and families spend time in your communities. And I know we're focused on kindergarten here today, but as we talked about, it really starts with birth. And so many families who have kindergartners also have younger children. So it's just a great reminder that it's also an opportunity to share information that supports children from those earliest days. So there's our email address. We'd be happy to hear from you if you have questions, and I encourage you to explore. Thanks.
Yeah, and similar to Learn the Signs Act Early, Let's Rise, we also have a web page that has strategies and free resources and communication materials that can be used by partners. So in particular, I'd like to call out a couple of resources that might be helpful to education professionals. CDC, we have a call to action for schools and school health partners that includes evidence-based ways schools can encourage routine vaccination, along with accompanying CDC resources such as fact sheets, parent handouts, conversation guides, and guidance around school-located vaccination clinics. We are actually in the process of updating our call to action right now for the 2024-25 school year. And so when the new call to action comes out, I'll make sure to share that with this group. But you can see the call to action from last year that has many of those resources on the webpage. In addition, we partnered with Public Health Foundation to put together 2 companion partner toolkits. There's a vaccination toolkit for education professionals as well as for early care and education providers. And they contain additional partner resources that are free, downloadable, actionable, beyond what we have on the CDC website that can be used by schools. And our goal is really to make this work as easy as possible for you, recognizing that schools have had a lot of turnover, staffing shortages, and an incredible amount of work that you're also undertaking to recover academic losses that were sustained during the pandemic. And I will drop our webpage into the chat and also encourage you to explore. Thanks.
Thanks, Kathleen.
I
Heidi.
can jump into Chris-Ann if that makes sense. So the American Academy of Pediatrics has a ton of resources, both for healthcare professionals, but also healthychildren.org is the parent-facing website from AAP. It has tons of content, including specifically around early childhood education, kindergarten readiness, et cetera, normal child development, immunizations. There's lots of content that might be useful to you. Actually, my own child's school, I didn't even prompt them to do this, sent out a link from AAP around school attendance in a newsletter from my child's school. So there's lots of stuff that touches on many different angles that might be of interest. But I think too, there's real power to the point about partnerships in understanding your local context and local players. For example, is there a primary care group or a hospital or a health system near you that may well have resources, guidance, initiatives going on that may feel even closer to home for you and your families. Just as one example, there's a movement among children's hospitals to become what's called school-friendly health systems. So that's the idea that health systems should be doing reflective practices and real strategy to align their priorities with those in the education space. And there may well be resources, materials, local champions in your community that might be worthwhile trying to connect with.
Thank you so much. Is there anyone else that would like to offer up any resources? Okay. So I want to remind folks to go ahead and put their questions in the Q&A box, and we will try to answer some of those live. Many of them we have been answering as we've gone along. But I wanted to highlight one because to start us off, because many people have been asking about different developmental screeners, like specific ones for specific ages. And I've heard, things floated around like ASQ and other tools. I'm sure many of you can't endorse a specific tool, but just curious if there were any specific thoughts related to where you could go and look about specific tools for specific ages on any of your websites.
I can start. I put in, I think this was a response to one of the questions, if I'm remembering, in the Q&A box. But just to answer practically speaking on the sequence for developmental screening in primary care. So Bright Futures is the name of sort of the best practice in pediatric healthcare in the United States. And Bright Futures recommends 3 developmental screens, sort of general developmental screens for early childhood. Typically, those are at age 9-month, 18-month, and 13-month well-child visits. And additionally, 2 screens specifically for autism. Those are typically done at the 18 and 24-month well-child visits. Now, of course, we all know some families may not attend all of those well-child visits, so the timeline is not always super precise there. And I linked to the AAP publication, which I hope folks can still see even without an AAP account, to some of the commonly used tools. There are a set of tools that are appreciated as validated tools and particularly appropriate in those settings.
Great, thank you, Heidi. I want to turn now to our Q&A box and Alan's question, because I think it is a really interesting one. And that is anyone on the panel aware of cases where child's entry into kindergarten may be one of the first contacts with public services since their birth? So they have not had the benefit of early intervention. And he's, thinking about maybe families where a parent may not be a citizen, but maybe their child is. And he's, wondering, are school staff trained on how to support such children and families?
And tackle some of that. I don't think probably any of us are the ones to tackle the school training answer to that question. So you might be able to handle that better than us. But it's a great question. And I usually love to emphasize the importance of all of the things we're talking about in supporting families, especially who don't have English as their first language. Again, just for folks, many of you, I'm sure, work with families like this, or may yourself not have English be your first language, are familiar with this. But if you're not, just think about it. Think how hard this is for those of us who do speak English well, how hard it is to access our systems. So just really important. All the comments we're making today are sort of doubly important for families in that situation. But yes, certainly, all of us in both health and education may be the first place that a family comes. And, one of the reasons why the healthcare setting is such an important place to provide strong supports for young children and families is because there are many children, not just ones who may be recent immigrants or don't speak English, where for whatever reason, they aren't participating in early childhood services. And so that kindergarten may be the first place where they show up, and it's really important to be aware of that. Certainly, I think we all believe and understand the data behind the importance of high quality childcare and preschool environments, and are trying to hope and work towards there being more availability of that, and certainly supporting families in choosing high quality settings like that when they're able to. But we're certainly far from everybody being in those situations. And so it just means that all of us, whether we're health providers or the education system, have to understand that's possible and meet families where they are and try to be supportive. And these partnerships that we talk about, the more they exist, the more we can sort of try to support and hand off and encourage to the other, right? If you're in an early childhood setting and you discover that the family has not accessed healthcare at all, which sometimes happens the other way, right? You can encourage that connection around supports for child development and supports for those immunizations that they need. And on the health side, when we see them and we ask, hopefully, about, where are the children spending their day? Who are they with? What experiences are they getting? We want to help the parents provide that supportive environment at home, but we also want to make that connection with local resources that may be available to them. And the citizenship question is an important one too, because there are government programs and local community programs that are widely accessible to people who don't necessarily have documentation, and there are others that are less available to. And so again, through partnerships, for us to really understand that, so we can provide that safe space to encourage families to tap into resources that they are able to access in ways that are supportive to them. We can all try to be good conduits for that. And that's what comes back to Heidi's comment earlier about, the different sizes of communities. Sometimes larger communities may have more resources, sometimes they don't, and sometimes they're harder to figure out. And sometimes in a small community, they're easier to figure out because they're sort of one program or one place. And so anyway, that's a long answer, but it's such an important point that I'm really, really glad that it was brought up, and hope those are some points that can help you maybe think about how this applies to the children in your community.
Thanks, Jill. Really appreciate that. And I'm curious, maybe Swati, from the Department of Education's perspective and sort of the connection with school, is there anything that you'd love to like to share?
Sure. I think that this panel is underscoring the critical need to work across all these sectors, all of us that have been engaged in this conversation today are really underscoring that we live in a world where these sectors tend to operate in silos. And I think that's why folks have been talking about relationships. One of the movements that I think is really positive to build these connections is the community schools movement. And the Biden-Harris administration has been making significant investments in community schools. When we think about families speaking multiple languages, where is that trusted relationship going to be? A lot of times it's going to be a community-based organization. So schools can be a hub and an anchor partner and open up those conversations to building those relationships to make sure we have folks who really have that expertise in the community to pair it with the kind of expertise that's been talked about here in a more formal way. I also want to mention that our Office of English Language Acquisition has created a newcomer toolkit to speak to that, and my colleague Erin Fresky has put that in the chat. And so there are resources and tools out there, and I think it's a question, and I think it was Jill who said, we've got to put children and families at the center of this work. And so the way to be comprehensive, the way to have a seamless experience, the only way to do it is going to be to figure out how we forge these stronger connections between schools, healthcare, communities, families, parents. It's all got to come together. And I think that's where, if we're starting at the most local level and grounding our efforts there and building up towards these larger agencies that are there to support, but it's got to be grounded in community.
Thanks, Swati. And that sort of, I think, dovetails nicely into April's question, which, she works for a national organization that has free resources for preschools, home-based providers, parents, caregivers. But as a national organization, it can sometimes be challenging for them to make local connections. And so her question is, what suggestions might the panel have for connecting with local champions to help with collective impact? Since we know so much of this really relies on local partnerships. Anyone want to tackle that?
Seems perfect for the campaign for grade level reading, since the campaign is mobilizing this effort around that very thing with 350 plus communities across the country. So it feels like, I don't know, Sarah, if you can, but the campaign has done amazing work in this space.
Yeah, I think that's the wonderful thing is that there are more and more state level and community level efforts that are really trying to do this sort of work. And the more that we can leverage those together, the better, right? None of them are perfect and a lot of them are great. And so depending on what type of information or resources you're trying to get out, you may have different partners, but Campaign for Grade Level Reading is an example. Help Me Grow is a national program with presence in many states trying to work at this, supporting parents in these early identification and connection. The American Academy of Pediatrics, as Heidi said, has a chapter in every state. So sort of thinking about state level, maybe if you're national, and that's kind of what we do first, from our program is free resources, but we rely on getting them out so people can incorporate it in the ways that they work for them, best locally. And so a state level connection, if that makes sense. And then hopefully they have more local connections, just depends on how things are structured. But and then as different national initiatives or different national agencies, as we keep working better together, right, we can kind of cross share each other's messages as well. And I feel like we're certainly at the CDC at Health and Human Services happy to be working with the Department of Education and partner, with ACF where Head Start is and things like that. We're all trying to do that a little bit better so that we can then make it easier, hopefully at the state level, and hopefully state and local can feed back up what we're doing that's helpful and what's maybe not, or what they'd like to see, so that we can all learn and do even better with that.
Thank you. Sierra, did you want to add to that at all from the campaign's perspective?
No, I think that was great. I was just going to use that as a little bit of a plug to promote GLR Week, because I think that is kind of the best instance of all of these communities working together and sharing information and kind of making that community coalition. So I will definitely be posting some information about GLR Week in the chat, but Swati and Jill appreciate that nod as well. And then Chris-Anne, I just hopped on. I was going to give you a little bit of a breather. You've been doing a great job as moderator, so wanted to bring up some additional questions before we wrap up. There was one in particular, and let me see if I can find it here. Let's see. Oh, there we go. And it looks like Heidi was in the process of typing an answer there, but an anonymous attendee asked, how do we get doctors in urban areas to partners with early childhood agencies? I know that's kind of a little bit easier said than done question, but Heidi, maybe if you want to take the lead there.
Yes, I love this question so much. Again, I worked for years in a much larger metropolitan area where we were interested in various initiatives and found even a clinic on one side of the street and a school or early childhood center on the other side of the street served all the same kids, but often none of the professionals knew each other. In more rural, smaller communities, that's less likely to happen. So I totally appreciate the feeling behind this question. I think I would still go back to, and this might feel different in more of an urban area, to start with relationships. Is there anyone, a member of your staff or a group of families that all go take their children to one particular doctor's office? Just starting somewhere, starting with that one person who's in many to most cases, I would say, the doctors are actually quite interested in partnership, but they too often don't know how to get started. They just aren't in the practice necessarily in their busy day, maybe of calling you on the early childhood side, just like perhaps you're not in the practice of calling them on the healthcare side. But I would say just trust that there is interest there as a starting point, and to start somewhere. A cold call is one thing, but if there's any individual relationship that you can leverage. The other resource that I mentioned earlier is every state in the US has a chapter of the American Academy of Pediatrics. So that's another great place to start. Those folks are typically coming from all across the state, working in lots of different settings. And if you don't already have a personal connection or don't feel comfortable with a cold call, your AAP chapter can be a great resource. And I'll drop my email again in the chat. I'm happy to help connect you with individual folks in your state chapter, or sometimes even local chapters, if that's useful.
Great, thank you. So many of you hopefully will probably see a poll that has popped up on your screen. And we would love for you to take a minute to answer that poll about the conversation here today. We'd love to get your feedback, and we will go ahead and continue the conversation as you're answering the poll, but just wanted to make everyone aware of that it is intentional, and if you could go ahead and fill it out, we would really appreciate that.
Chris-Anne, can I jump in just for a second?
Sure.
So I was trying to do such a good job with partnership conversations, and I forgot to mention one of our own resources, but Katie put in the chat. Learn the Signs, Act Early. We actually have what we call Act Early ambassadors in almost every state across the nation, and their job, but what they do in that role is to really kind of help connect the dots. So they know our resources really well. They're usually work in their day job in an environment that really touches on young children in a variety of different ways. And so it's the best connection in terms of you can certainly tap into our resources from the national website, but to talk about partnerships and how to leverage them at your state level across these sectors with respect to child development and these things, check it out. And you can get their contact information from your state from the Learn the Science webpage. Thanks.
Thank you so much. Really appreciate it. We do have a question from Nikita. I'm not quite sure if there are any panelists that want to tackle this, but I might point folks in one direction as well. The question is, what can be done to unite the efforts for reading success for students nationwide, given the fractured approach to teaching of this foundational skill at the state level, which then in turn will continue to affect access to our society and success in it? Curious if anybody from Campaign from Grade Level Reading would want to take a stab at that. I'm happy to at least share a resource that I know is coming out, I believe this week, from the National Association of State Leaders of Early Education on reading. It's a policy brief that's a consensus document amongst state leaders around the importance of reading and what the science of reading really is and means. That might be a helpful tool or a resource. And that's from NASLE.
I'll add one, Chris-Ann, which was in the resource slides in the deck that we shared. That's out now, which is available to all states. And you're probably familiar with it. It's the Comprehensive Literacy Grant for states. And one of the things I love about it is it starts at birth. And it is an opportunity for the birth to 5 community to connect and work and do the planning on literacy with the elementary grades. And it specifically calls out funding for both those sectors and joint planning. And that is currently available for now. So if your state is not engaged, it's an opportunity to have resources and planning. And this year's grant competition also includes the early math in there as well, in addition to reading and literacy.
Thank you, Swati. Appreciate that. Sierra, are there any other questions that we'd like to try to tackle before the end of the session?
I think thankfully all of you have done a great job at answering most. I was going to have Heidi actually, she had answered a question, she typed an answer out, but I wanted to bring this up again. Let me see if I can pull that up. But I do know that the question kind of dealt with, you know, grappling with this. Let's see here. Where did it go? Heidi, you might be able to pull it up quicker, but just, you know, kind of making sure that we can incorporate some well-trusted voices into this conversation to eliminate any senses of, you know, doubt or hostility or, you know, frustration towards the topic, but really making sure that these perspectives are coming from trusted voices. Do you have anything to add there? You want to?
Yes, I love that. The question I believe was about schools feeling some hesitancy to even talk about vaccines, encouraging vaccines because they're political. And I think during COVID, when I was in a role in a school district, what we found is that folks really needed to hear from trusted voices especially from within the community. So we as government officials or as even leaders of the school, even when we're trusted on other topics, sometimes with more perceived controversial ones, especially hearing from folks from local communities, especially those who are external and maybe seen as more neutral, can be a really powerful tool. I was working in DC schools during the pandemic, and we knew that, for example, communities of color were experiencing COVID really differently from other communities. We specifically prioritized educator and family-facing events that prioritized voices from within the parts of the city that were more heavily impacted by COVID. We had healthcare providers of color, healthcare providers who are immigrants, specifically to bring voices that may be perceived to be more trustworthy, and found that to be very well received. And again, your local AAP chapter, again, is another resource of folks who might bring a diversity of perspective, thought, role. So that's a practical place to start.
And just to add to Heidi, I agree with everything you said. And I think in some of the research that we found about vaccination messaging is that parents really want the information. They want to know what these vaccines are doing. They don't necessarily want to be told what to do, but to be given the information so that they can make informed decisions.
And I think it's a real opportunity that we have now. COVID was just such a hard time, and I mean, the worst of the pandemic was such a hard time. And we have such an opportunity now to collectively go back to what we always wanted, but this holistic approach to health and partnerships, and that COVID vaccines are part of all of vaccines, that vaccines are part of preventive healthcare. Preventive healthcare includes child development and all of these things. And if we sort of can go back to that, or encouraging that on all sides, then we can build these relationships where parents are getting information informed information to help them make the best choices for their family. And we know that all parents really want what's best for their family, and what's hard to sometimes sort through all the noise and stress that's happening on so many fronts. And so again, I think messages that combine these issues and combine these conversations and help families go where their trust, some may trust the school more than they trust the healthcare provider, or vice versa, or their childcare provider. And that's okay. We don't need it to be a competition. We want it to all of us be working together to try to meet families where they are and provide them with the best information.
Yeah. Thanks so much, Jill. And I'm gonna let that be the last word. And I just want to say thank you to Heidi and Jill, Kathleen, Swati, for joining in this conversation today. And thank you to Sierra and Sarah at the Campaign for Grade Level Reading for hosting this conversation. And I'll go ahead and turn it back over to you, Sierra.
Yeah, sounds great. And thank you, all of you. This was fantastic. I'm excited for you all to look through the chat and see all of the messages and commentary that was happening during the conversation. I think as well, when we were planning the conversation, we wanted to focus on the importance of bridging together education and healthcare, and why those two sectors are so vital. And I think you all did a great job of showing that importance. And so thank you again to all of you. Really appreciate that. And Chrisanne, thank you for moderating a great conversation as well. And as we wrap up, just wanted to take a few seconds to promote some of our upcoming webinars that we have. Next week on May 14th, we'll have a 3 p.m. session, What's Working to Narrow Academic Achievement Gaps Post-Pandemic, Insights from School Districts. So that taps onto the COVID discussion that we were having as we wrapped up. And then on May 21st, we have an exciting double header. First, a funder to funder conversation on harnessing philanthropy to cultivate learning in everyday spaces. And then at 3 p.m., not just nice, but necessary family engagement, a big bet that's paying off for kids. More information and full blurbs on all of those great sessions will be posted in the chat box and are on our website. But yes, thank you again so much to everyone. Really appreciated the conversation, and I hope you have a great rest of your afternoon.